Okay, so this gram staining that we actually learned in general microbiology, right, is actually it actually has an application in trying to diagnose what or investigating what respiratory system diseases. Okay, so we have been looking at different ways. So this one is mainly focusing on the gram stain. All right. What is the application of this gram stain in diagnosing or a respiratory system disease? Okay. So these are different types of respiratory system disease that we have: pneumonia, tuberculosis, occupational lung disease, pulmonary embolism, pulmonary fibrosis, different types. Okay. So that this gram stain is a microbiological investment which is used to identify bacteria in respiratory secretions. Okay. Such as what? Sputum or bronchoalveolar lavage fluid. Okay, so it is a crucial tool in diagnosing respiratory diseases which could be caused by what? Various bacterial infections. Okay, so for this, how does it work? First of all, you have to actually collect a sample. So the sample could be sputum or it could be what? Bronchoalveolar lavage. Okay, so it could be collected from the patient. Next, the sample stained with a gram stain, which actually consists of what? A crystal violet, an iodine, an ethanol, and safranin. So all of them, their roles is actually by the side. Well, I've spoken a lot about gram stain, so I don't want to waste time. So for microscope now, the stain sample is now what? Examined under microscope. Okay, so you see it: the crystal violet, the iodine, the ethyl alcohol, the safranin. Okay. So what are the results? If the patient is affected by gram-positive bacteria like Staphylococcus, Streptococcus, Pneumococcus, you actually see a purplish stain. Okay, and it's suggestive of things like pneumonia, bronchitis, sinusitis. Okay, so if it is gram-negative bacteria, you see things like pink or reddish. Alright, like Haemophilus, Klebsiella, Pseudomonas. Right. So it's suggestive of things like pneumonia, bronchitis, exacerbated chronic respiratory diseases. Okay, so it helps us in diagnosing a lot of things like community acquired pneumonia, hospital acquired pneumonia, ventilator associated pneumonia, chronic bronchitis, cystic fibrosis, tuberculosis, and all of that. Okay, so for limitation, it can't actually dictate all type of bacteria. It requires proper sample collection and handling. Interpretation requires what? You to be an expert for you to be able to this thing, interpret a gram stain um, test result. Okay, so that's it on using gram stain as an investigation. Gram stain as an investigation method in diagnosing respiratory system diseases.